A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a decisive move on Wednesday evening, Republicans in the House of Representatives passed a healthcare reform bill aimed at addressing the rising costs of health insurance as the expiration of Obamacare tax credits looms ahead of the midterm elections. The legislation, known as the Lower Healthcare Premiums for All Americans Act, was introduced by Republican Representative Marionette Miller Meeks from Iowa and passed with a narrow margin of 216 to 211, largely along party lines. The vote saw just one Republican, Representative Thomas Massie of Kentucky, break ranks to oppose the bill, while no Democrats supported it. Miller Meeks defended the bill on the House floor, asserting that it would lower healthcare costs by promoting transparency and implementing practical solutions. By lowering premiums through choice and competition, and by expanding association health plans, we empower small businesses and self-employed individuals to negotiate better rates, potentially slashing premiums by as much as 30%, she stated. Additionally, she emphasized the necessity of transparency in drug pricing, aiming to tackle the influence of pharmacy benefit managers who have been criticized for contributing to rising prescription costs. Meanwhile, Republican Representative Brett Guthrie from Kentucky criticized the Affordable Care Act, ACA, labeling it an unsustainable system that has led to skyrocketing premiums since its inception. Healthcare spending has nearly doubled since Obamacare was introduced, and millions of Americans are burdened with medical debt due to high out-of-pocket costs, Guthrie remarked. He further pointed out that premiums have surged by 80% since the ACA's rollout, with patients facing an average deductible of $5,000. The passage of the bill is seen as a strategic victory for House Speaker Mike Johnson, who has been navigating significant divisions within the Republican Party on healthcare issues, especially as insurance premiums are anticipated to rise in the coming weeks. However, the future of the legislation remains uncertain as it does not extend the enhanced subsidies from the ACA, which are set to expire at the end of the year. Earlier on the same day, a group of moderate Republicans joined Democrats in a discharge petition to force a vote on extending these subsidies for an additional 3 years. This maneuver, which allows lawmakers to bypass House leadership to bring specific legislation to the floor, signals a potential clash in the new year, as the majority of House Republicans oppose extending the subsidies without substantial reforms. Conservative leaders have expressed that the subsidies merely perpetuate a flawed system without addressing the core issues driving healthcare costs. Republican Study Committee Chairman August Pfluger from Texas described the bill as a solid first step toward meaningful reform. The Lower Healthcare Premiums for All Americans Act includes provisions to codify association health plans, enabling small businesses and self-employed individuals to band together for better healthcare coverage options. Additionally, it proposes funding for cost-sharing reductions starting in 2027, aimed at lowering out-of-pocket expenses for individuals. House GOP aides have indicated that these measures could lead to a 12% reduction in premium costs. The legislation also introduces new transparency requirements for pharmacy benefit managers, who have faced bipartisan criticism for their role in inflating healthcare costs. The Congressional Budget Office, CBO, has projected that the bill could reduce the federal deficit by $35.6 billion over the next decade, although it may also result in a decrease in the number of insured individuals by an average of 100,000 per year from 2027 to 2035. As the Senate contemplates the next steps, the path forward remains unclear. Last week, Senate Republicans were unable to advance their own healthcare plan and also rejected a proposal from Democrats to extend the Obamacare subsidies. The ongoing debate highlights the contentious nature of healthcare reform in the U.S. as lawmakers grapple with rising costs and the impending expiration of critical financial support for many Americans. As the political landscape evolves with the upcoming elections, the healthcare debate is set to remain a focal point, with both sides vying for solutions that will resonate with voters concerned about their healthcare costs and access to necessary services. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.